From darkness to light, from confinement to freedom. This is the Reentry Journey Podcast with your host, Cardell Sims, bringing you the powerful stories of those who have walked through prison gates and built meaningful lives beyond them. These aren't just stories of survival. They're testimonies of transformation, second chances, and the human capacity for change. Join us as we explore the challenges, triumphs, and lessons learned on the reentry journey.
All right, man. Welcome back to another episode of the Reentry Journey Podcast. I am your host, Cardell Sims. And today, I just like to say we got two incredible guests who will be joining us, and they are transforming how we approach reentry services across the country. First, we have Mr. Oscar Benitez. He's the manager director at Third Sector, who brings nearly a decade of experience enhancing government systems for communities facing significant barriers. Oscar has successfully launched cross-departmental initiatives that reduce both incarceration and homelessness. And he's a Gates Millennium Scholar with a unique background spanning investment, broadcasting, and research. Joining Oscar is Mr. Paul Solomon, who has dedicated 19 years to reentry work and currently serves as the co-chair of the Governor's Racial Justice Council on Criminal Justice Reform. Paul also sits on the Governor's Reentry Council and has chaired numerous organizations, including the Days Killer Bread Foundation and Lanes County's Public Safety Coordinating Council. Together, they work for Third Sector's Reentry Division, where they have housed over 200 people in just 3 years while providing comprehensive support from housing to counseling and case management. Today, we're diving into their episode titled From Systems to Solutions, How Outcome-Based Models Transform Reentry. Oscar and Paul, welcome to the Reentry Journey.
Beautiful. Thanks for having us, Cardell. It's a real pleasure and honor to be here.
I appreciate you all having me. I appreciate you all being a guest, excuse me. But let's get off into it. So, Oscar, you've been in the reentry space for 10 years and Paul, 19 years. What initially drew each of you to this work?
Yeah, I happy to start. And again, Cardell, thanks for having us here. You know, my first interaction with this was actually teaching a course in Philadelphia inside of a jail. And I met a number of men that were transitioning either from prison to jail or from jail to prison. And the reality was, as a college student, I was learning so much. They were learning so much, and we had just a unique opportunity to learn together. What was unknown to me is what their future looked like. You know, these are things that wasn't talked about in our families. Some of them described it as a dead end. One guy I'll never forget said, "This is all I know. This is my community." So for me, you know, as a college student at that point, I recognized, how can I do better? So really building the skills, the relationships that brought me to Third Sector, bringing me to, you know, support important work to ensure that the vision that we want for public safety and for housing actually comes to fruition.
Okay. Paul?
Yeah, thank you. You know, I've actually been involved in this work for over 30 years, and I came to this work through personal experience and deep conviction. I spent over 8 years of my life in state and federal prison in the 80s and early 90s. And I've seen firsthand how the criminal legal system can strip people of their dignity and make the reentry process nearly impossible. But I've also seen what is possible when we create systems of support instead of systems of punishment. And that belief, the belief that people deserve a second chance, has really guided my career. Housing, stability, and supports aren't luxuries. They're the baseline of a just society. And I believe that the program that we've developed with The Way Home was really built to honor that truth.
Okay. And you all been working multiple years in this space. How has your perspective on reentry challenges evolved over the years?
I'll jump right in. So I'll say early on, I focused on individual transformation, helping people find jobs, get clean, reconnect with their families. And I'll say for almost 25 years, I was in a leadership role and the executive director for a good chunk of that at Sponsors Inc., which is a reentry organization in Oregon. So early on, my focus was really on individual transformation, helping people get their needs met. But over time, I saw how the structural barriers, especially the lack of stable housing, set people up to fail, no matter how hard they tried. And that shifted my focus to system change. Now I work to break down the silos between housing, healthcare, parole and probation, community-based supports. And the way home is really an embodiment of that evolution. It's not just a program, it's a system solution.
Okay. And before you jump in, Oscar, I want to say, you mentioned about the silos. How important is it working, having people break out them silos and working together on you all's end?
Yeah, it's fundamental. It's instrumental. Like if we can't break down those silos and find ways to work cooperatively through different systems, we're destined to kind of do what we've always done, which hasn't been very successful. So it really is fundamental to this work.
Exactly.
Yeah, the siloing's big, and maybe that, it's also been part of my evolution, because Cardell, for me, it was volunteering, right? It was being inside of a jail. Personally, I have cousins that are incarcerated. So again, it was very personal in that sense. So my evolution was, well, what can I do about that? Mm-hmm. So that explains in many ways kind of my career working in on Wall Street, doing research, coming to a place like Third Sector to say, look, I don't want to just talk about it, I want to be about it. And so for me and the rest of the 60 people that are part of Third Sector, we're trying to build the tools and practices that allow the public systems that Paul just described to do more and do better for people that face those high barriers to economic opportunity and well-being. So I see that personally day to day. But to me, I'm curious about how do we change the bureaucracies? How do we get rid of some of these silos between, the correction system, the housing system, the behavioral health system that aren't always talking to one another? So if we can be the connective tissue, great. We can. This is a solvable issue in terms of homelessness and public safety. The question is, how are we investing our resources? Number one, that we all contribute to, by the way, as taxpayers. And then number two, how do we empower people to articulate that this is what works? Let's do more of it. So we were fortunate, again, to talk to people in Lane County and Eugene, Oregon, that have been doing this work for decades. But they had a really unique opportunity to bring the criminal legal system, the housing, and the housing folks to the table to do something innovative.
Mm. And you was talking about your background, Oscar. I do want to ask, how has your background as an investor and researcher influenced your approach to reentry solutions?
Good question. Probably the best way I would think about this is I want to make sure that our county government, our city governments, our state governments, that we're investing in the stuff that works, right? So if you go to McDonald's, you go to Burger King, their CEOs and their managers, they have a number of initiatives that that they can look at and say, okay, great, this is what's working. Our drive-through is on point. Our our chairs and tables are clean, and we can do better. Right. On the government side, I always wonder, where's the scoreboard? How are we doing as a Department of Corrections? And that scoreboard isn't really great. As you, Cardell, know, and Paul, the scoreboard is, on average, 7 out of 10 people that go through jail or prison come back. What does that say about our system? So if something's not working, let's do something different. So that's really from my perspective, and really from the folks at Third Sector, which is, if something's not working, how do we do better, not strip it down? And then second, if there's an opportunity to do more of what has been functioning, which in Lane County has been mentorship, therapy, housing, meeting people where they're at, is there a way then to look at their public safety funding, their housing resources, and integrate it in a way so that if you're leaving prison and you're homeless upon your return, you have what you need to thrive? And no one knows better, in terms of how to do that than sponsors, and then obviously their partners, parole and probation, and the housing authority.
Right. Yeah, it's mandatory because I don't care how many programs you take on the inside. If you come out and you ain't got no housing, all of that goes out the window, right? Because you got to figure out, before I worry about anything I learned, then I need to figure out where I'm going to lay my head, where I'm going to get some sleep, right? So that definitely is one of, and the crazy part is, like you all said, around the country, like I've been around speaking in a lot of prisons, and everywhere I go, the number one problem is housing. Some people get, I think, like in Florida, they some people got tree houses, some people got tents, some people got to go stay out on the boats. Like it just don't make really too much sense for me. But let's get into third sector's approach though. What does an outcome-based model mean in the context of reentry services, and how does it differ from traditional approaches?
Yeah, definitely. I mentioned earlier, we got about 60 folks on, worked in over 35 states in almost 15 years now. And our approach really is almost like that of a gym trainer, if you think about it, but for government. Where we're trying to build the tools and practices so that their programs are responsive to local needs. What that means is, on the reentry front, how do we ensure that people that have completed their sentences and are ready to come home, how do we make sure that they got a place to live, a place to learn, and a place to work, and be well? For us, oftentimes it's talking to people with lived experience. They're the true experts, right? They're the true experts on what they need, and hearing about what are their needs and their solutions, and then working with government as the muscle for innovation. I really want to underscore that. There's so much money. We're talking about trillions of dollars in the county.
You hold on now, because you might have some people might say there's no money out there for this because the new president and all this stuff.
And that's real. That is very real. But nevertheless, our systems exist, right? They exist. So we have to figure out ways on, again, how do we do better and make sure that we end the cycle of reincarceration. And, and then the situation in Lane County, there's also this cycle of homelessness that comes with it. So from third sector's perspective in diversion and reentry, we view housing as public safety. Like, people coming home from prison may not need more supervision. And in fact, they may need stability, and housing is a foundation for that. Especially if the reason for their incarceration had to do with drug addiction, for example, things that may not necessarily be violent. Paul has been central in that work. So our role is really to find those thought leaders in government and in the community and equip them to do more of what they've been doing.
Exactly. Okay.
And let me tag on to something that Oscar said. I think one of the things that made the work that we did at Sponsors so successful was being able to tap into local and state government resources. As a nonprofit organization that started in the 1970s, it was volunteer run, and we wrote grants and got donations, but it wasn't until we got our first contract with parole and probation and Department of Corrections that our work really began to blossom. And so it is about aligning these systems and tapping into the resources that are available through local, state, and federal government.
Right, because a lot of community organizations, especially new ones, especially those that are formerly incarcerated individuals coming out, and then they want to start, they don't understand how to tap into those county and state resources.
Yeah.
And so you all housed over 200 people in 3 years. What specific challenges did you face in achieving that milestone?
Well, I would say it was really about partnerships, about trust, and a shared commitment to doing things differently. We brought together our local housing authority, our parole and probation department, other nonprofit providers, and put them all under one roof. I mean, literally and figuratively. We were able to tap into Section 8 vouchers. We utilized 90, almost 100 Section 8 vouchers through the Housing Authority. We leveraged capital from the state to help build a new 52-unit, beautiful apartment community. And we created wraparound services that really were designed to meet people where they were. You know, we were targeting people coming out of prison who were homeless, indigent, and at high risk of re-engaging in the system. And we didn't just coordinate, we aligned these systems, and that's what's made it sustainable. The housing 230 plus people wasn't a fluke. It really was a result of systemic collaboration.
Mm-hmm. Exactly, and I like that you all have them all under one roof, right?
Mm-hmm.
Like that's the key element, because like you said, now we're able to focus on that person and meet them where they at.
Right, and I think the thing that is, you know, most powerful, and we've been talking about this a little bit, is the housing, right? Like, we can provide all the services in the world, but if someone doesn't have stable housing, a safe place to lay their head, and I'll say the housing that we're providing is really quality housing. It's, you know, built and designed for the populations that we're serving, and it makes a difference in how people respond when they come to a place that is aesthetically warm and welcoming and beautifully landscaped. They respond to that, and then when we layer on the services and the people, it makes a huge difference.
Right. Yeah, because a strong, healthy, stable environment for housing is important, because what I was just telling someone this the other day, what a lot of people don't understand, they hear transition centers or halfway houses, they think that these are always great. And I had some people know some halfway houses and transition centers is just unhealthy as you going back to the neighborhood.
Yeah,
right. And so housing is important, but the biggest part, like healthy, strong housing, is the most important, because there's some transition centers, there's some halfway houses that people got to carry guns in, right? Because of not just the environment of the halfway house, but the environment outside of the halfway houses as well. Like, I'm from Missouri. There's one halfway house in Kansas City where it's almost either, if you go to that halfway house, you're gonna have to carry a weapon, or you're gonna have to be careful. You know, I chose to go 2 hours away just to avoid, to make sure my housing situation was healthy, because I've been to prison 5 times. So the first 4 times I got out of prison, yeah, I had a home plan and housing, but the environment wasn't healthy, you know, and things like that. So I think a lot of people don't really understand the importance of having that, what third sector does. Strong housing, healthy housing. Not only that, with the access to the resources and things right there for you.
Absolutely, Cardell. You know, as a person who's experienced that transition, starting out in what I would call substandard housing, where you're putting 4 and 5 people in a room, you know, those type of programs often do more harm than good and feel like an extension of the prison system itself. You know, so it really is critically important, the type of housing we build, the way it's structured, the way it's designed, and the type of people that we train to work in those programs. And I'll tell you, the thing that, you know, if there's a secret sauce, it's the people that we hire to work in these programs, and they're people with lived experience. And we don't just take them straight out of prison. We make sure that they get the professional development, the training, the skills that they need to be able to role model, to be able to work with people and provide that hope. Because when they see someone like you or me, and they did time with us, and they're thinking, wow, if Paul can do this, maybe I can do it too. Look at Cardell. Wow. I think that's really powerful. And that's one of the pieces that I think is fundamental to successful reentry programs.
Right. Yeah. Go ahead, Austin.
Yeah, I think that's really spot on, Paul. I'm so glad you mentioned that because, if I recall correctly, more than half of sponsor staff, like Paul, have lived experience with the criminal legal system, or potentially living on the streets. And our role, within third sector is to work with governments and say, look, lived experience, that is as valid as all the research, as all the universities, that put out there, as all the policy points that come out. It's all on an equal footing. I really, really want to emphasize the point that, sponsors and all the community-based organizations do this type of work. They're not just service providers. They're proof that reentry works, right? If they have the lived experience in-house. We can't miss that. And the way, through the way home that we saw that, you had people that are peer mentors, available 24 hours a day, 7 days a week.
Oh, yeah.
People were living in the same units, nearby. In fact, there was, even parole officers were co-located almost as neighbors, right? Not as someone swooping in, swooping out. And it's a case planning model, that's tied to therapy and a number of just humane practices to meet people where they're at. So from our perspective at third sector, that is as important as the evidence-based research and all of the other expertise with college education and graduate degrees that we may not have. But that's the point, right? Is bringing it all together and ensuring that our public systems can support it and grow it because it's working.
And how did you coordinate all that? The government agencies, the organizations, the formerly incarcerated individuals, and how do you coordinate all that?
Yeah, I think the first one under coordination is having a clear understanding on the challenge, but also what does success look like, for this population. So I remember a lot of these conversations in 2016 where we looked at why is it that almost half of the people that we're describing, released from prison, medium to high risk to recidivate, homeless upon return, right? Why is it more than half are being rearrested? Why is that? And you look at the root of the issue, housing.
That's right. Housing.
Okay, great. So if parole and probation says, I have a recidivism challenge I'm trying to address, and the solution is housing, we are then knocking on the door of the housing authority, which every county has in the country. And they say, great, I have housing resources that can address this need. And Paul already alluded to this, access to housing vouchers, creating a priority for this population, to address kind of the long line that kicks in. And then also getting creative, by saying, look, there's a building that has almost 50 units so we can house people, but we can also look at scattered site permanent supportive housing. How can we leverage the portfolio of the housing authority to make their affordable housing units, public housing units accessible to this population? So Cardell, that was kind of the biggest thing. It's one, we all agree on the challenge. We dig deep to look at the root cause of that, and then ask ourselves what resources are currently here. That's the other big piece. There wasn't a new funding request. In many ways, we were, to Paul's point, we were aligning the existing players at the table. So we're pulling on the rope at the same time without miscommunication, without these barriers that would otherwise create a very fragmented space and would allow someone on their own to say, I got to go talk to the housing authority for my voucher. That is one thing. I got to go talk to my therapist for something else. And by the way, I got to look out for my things because I'm living, under this bridge because it's the only place, for me to prevent me from getting wet, in the rainy Oregon. Paul, I'm curious. I mean, this has been central to your work, for over 3 decades now. Working at the intersection of of public systems and systems change. These are many of your personal relationships. If I'm not right.
Yeah, absolutely. And so much of this work is built on the relationships and cultivating those relationships with elected officials, with people in public safety, with our housing authorities, to bring them together, but also to be able to help them think about people in reentry differently. The conversations I've had with our probation department over the last 30 years has been an evolution. When I first started this work, their mantra was trail them, nail them, and jail them. It was all about compliance and trying to catch people doing something wrong. That's evolved. And I like to think that the work that we do is helped in that evolution. Same thing with our local housing authority. When, I started this work, people with conviction histories had a horrible time accessing vouchers. They'd have to get at the bottom of the list. It'd take years. And then through conversations we started having with them, they recognized the value and importance of housing this population, right? That by providing housing and then the services that sponsors provides, that we can really make a huge difference in, recidivism, in use of public services, whether it's emergency rooms, jails, all of that, and have really changed their approach over the last 10, 15 years as a result of the conversations that we've had.
Okay. And so, well, we do got a question. Mr. Gary Bullard, he asked, how does one connect with yourself and the agency?
That's a great question. So the services that we provide are Oregon specific. They can certainly reach out to me. We can make contact information available. But what we're talking about here is really being able to lift up a model that people can access, that can be replicated. So, those are conversations that we're excited to have with folks, and certainly happy to provide contact information for people to get in touch with both Oscar and myself.
Right. I think that'd be, I was going to ask, how can we replicate the model? I'm pretty sure it's going to be a lot of people tuned in, someone's tuning in right now that might want to replicate that model in their area, in their city. I definitely want to replicate that model up in the area that where I'm at, because they kind of behind on reentry. I hate to say it, but I don't know what they got going on. But yeah, it definitely needs to be replicated. I really love the model. What are some of the success stories that you all have for some of the people that's been through third sector?
Yeah, so we'll talk about the sponsors program, but first, before we do that, I want to talk about kind of the metrics for success and what we've been able to achieve through the project. Housing is clearly foundational, but it's what happens next that tells the full story. And for the way home, the primary metrics we tracked were housing stability and recidivism. And only 11% of those placed in housing through the program have returned to prison over the last 6 years. That's a 60 to 70% reduction in recidivism. Yeah. In our broader work, we actually track a number of different outcomes in our transitional housing, but I wanted to make that point first because I think it's really important for people to understand the impact of these programs. In terms of the personal impact on individuals, I'll tell you a story of one of our residents. We'll call her Maria. She had cycled in and out of jail for years due to an untreated mental health issues, and she had drug and alcohol issues. She didn't have any family support, and every time she got out, she winded back out on the streets, and it was just this revolving cycle. When she came through sponsors and we got her into the way home, she got a stable apartment. The first place she had lived that was her own in over a decade. She had a dedicated case manager, and she had access to mental health treatment and a lot of other supports. Today, she's been clean for over 5 years. She's volunteering in the community. She's mentoring other women. And that's not just a success story, that's a life reclaimed. You know, so those are the type of stories that we see in this program.
Thanks for humanizing that, Paul. That's so real, like day to day. And, you know, I'd say, Cardell, you know, at the systems level, as far as success stories, I mean, there's probably two things I'll mention. You know, the first one is probably less important, but worth putting out there. You know, our staff, you know, in many ways, they learn how these systems work, how you untangle them, how do you align them, what are the public funding streams that are super flexible. Let's say they're allocated for public safety, but you can invest in rental subsidies, for example. Okay. Look at workforce programs for reentry. So I think for our staff, you know, they've continued to do cross-system work. So think about reentry and housing, reentry and workforce development, reentry and behavioral health. So I think that's a big one. But I think that the biggest one is what Paul and I are describing here with the Way Home. You know, we've helped design and implement in many other places with the similar results. You know, there are 2 projects in Santa Clara County in California at Silicon Valley, San Jose. Focus on this, looking at individuals released from jail, high utilization of emergency room visits, and either providing permanent supportive housing or really intense behavioral health services and psychiatric support. There were 2 initiatives in Utah, in Salt Lake City. Same approach here. We're providing rapid rehousing for the reentry population, or you're providing a workforce development program. Same thing in LA. You know, again, permanent supportive housing. So I think the big, I guess, success story here is no matter how you cut it, big city, wealthy city, semi-rural, red state, blue state, purple state. The reality is that permanent supportive housing works in reducing rearrest rates, no matter how high the risk to recidivate. And then the second thing is when you can do this across systems and you can focus on the outcome. Again, Paul's focus, right, was no matter what we do, let's get the recidivism rate down. Let's make sure housing stability stays high. Let's focus on that. If we can focus on that, then and tie the funding to that, we will be accountable to one another. So those are, I would say, are the success stories that we see in other governments, which really means that it's not, you know, Lane County is very special, but you know, where you are in Missouri, there's a lot of special there too. Same thing in Ohio and Michigan and Pennsylvania, Florida. It's there. It's just a question of figuring out, to your point, Cardell, how do we bring people under the same roof to work together on this topic with a laser focus on the result that we're working on.
Okay. I remember, reason why I'm bringing this up because I'm thinking about some, you know, challenges that you all may face. And when I first got out of federal prison, this was my last prison trip in 2017. I had a friend who was on my case who one of the children of his mother is a parole officer. And probably like at about a year and a half when I got out, she was explaining to me they had a program similar. But what came with the program, she worked probation and parole. So they provided your high risk offenders with housing. You know, they provide first month rent, last month's rent, maybe not to the extent of you all, but in our area, this was kind of new. So it was kind of like a pilot program. And they was giving them $500 a month, got them a phone, connected them with the resources, behavioral help, job, employment, everything like that. But on the flip side, you know, the guys had to take counseling sessions, had to call in every morning to see if they had to drop a UA, you know, the stuff that you have to do when you're on supervision. The problem they was having, or the challenges they was having, they people weren't showing up to the counseling sessions or to the classes and things like that. So do you all face any challenges and things like that?
Yeah, I think one of the biggest challenges that we faced over the years is how fractured services are. So it used to be that when someone got out, we would have to send them to the county behavioral health department across town. And that meant someone getting on the bus, making sure they get there on time, being able to navigate those systems. And if you've been locked up for 20 or 30 years, just getting from point A to point B is difficult, let alone doing it on a schedule and with all of the pressure that comes with, it being a mandated or, required thing that you have to do for your parole officer. Drug and alcohol treatment might be over here. Employment services over here. And so one of the things that we started to do was co-locating all of these services under one roof. And I think that has been just a transformational shift in the delivery of services, because we know that people struggle, and it may be because they've been locked up a long time. It may be because they have mental health challenges, and we can't expect them to be successful when we create all of these barriers to them being able to get from point A to point B. So I think that's one of the things that has been one of the biggest challenges and one of the biggest solutions that we've come up with to address that challenge, is by putting it all under one roof.
Man, yeah. What I like is when we bring up the challenges, you all have the solution. Because a lot of people have the challenges and they don't understand the solution. And that's like you said, I think that's the biggest solution to that. Because people don't understand how, unless you've been through it, you really don't understand how frustrating it is when you get out and you got to go to these 8 different places, and you got two way out east, you got 2 way out north, you got 2 way out south, you got 2 way out west. You might not ever, like when I got out, I never rode buses. I didn't know how the bus system. I ain't never rode no bus system. So I'm trying to figure out how the bus system works. So you're trying to figure out, you got to get off this bus and get on another bus. So you don't know how to coordinate the time to make sure you get there on time. So by the time I definitely like that. We do have another question for someone who's watching. They say, how is Oregon bridging the gap between healthcare and corrections? I too would like to access to the model and the data you are sharing. Is there a link?
Well, I'll talk about how we bridge the gap to healthcare. And it's another system that, has been disconnected, right? Where people have to figure out how they get a primary care doctor. And what we saw is that people would come out and they might have a 15-day supply of medication, or they might have no medication. And so instead of being able to go to a doctor like most people do, they'd wind up in the emergency room just to get a prescription refilled. And that is the most expensive and least effective way of delivering healthcare. So what we've been able to do is almost all of the people that we serve are eligible for Medicaid. So we get people signed up for Medicaid immediately. We make sure that they have a supply of medication to get them through to their first visit. We get them hooked up with an array of providers, because it's not uncommon for people to come out of prison with a lot of untreated health issues that have built up for years. You know what it's like going to the doctor in the Department of Corrections.
Give you some ibuprofen and some water to go on about the business.
That's right. Here's some ibuprofen, right? Like, okay. So making sure that people get access to that healthcare, I think, is huge. We did an evaluation of our program, our long-term housing programs, when we first started this. And what we saw is that people who were in stable housing, their healthcare utilization was much better. The inpatient stays and emergency room visits went down. Primary care went up. Access to behavioral care went up. prescription medication access went up. And those are all things that we want people to access. So that's a great question. And it is one of the key things that we need to hook people up with when they get out. And Oscar, maybe you talk about kind of the links and how people can,
Definitely. Cardell and for other questions. We are open book. This is a model. It is working. We can definitely share the links in terms of what it took to coordinate the different systems, the results, and then also, in many ways, how do you resource this, with staff and funding. There are a couple other points I want to add to this at the state level, because Oregon and many other states are really leaders in terms of how they think about their healthcare investments. Oregon, like California, like Michigan, Washington, number of states, they are making explicit investments with their Medicaid funding to support reentry. So Paul mentioned, ensuring that men and women are enrolled in the healthcare plan. Great. In Oregon, 90 days before your release, the system is now looking to enroll people before they're out. So that addresses the whole paperwork challenge that we know is a real big issue, especially if you can't get a hold of your ID, your passport. The paperwork shouldn't prevent you from having good healthcare. So that is just it sounds so mundane, right? It's paperwork, but it's the paperwork that creates all these barriers. So that's one thing. The other thing, Cardell, is, the state of Oregon, they are investing their healthcare dollars in rental assistance, for men and women released from jail or prison. So again, that's just a recognition of what are, the root causes for the cycle of rearrests. And if being homeless is one of those, by definition, homeless, how do we get more homes? And if that means we can help you, work your way through with rental support on one end of the spectrum, or on the other end of the spectrum, access to permanent supportive housing, which is what we're talking about here as the model. You have secure, stable housing. You're not going to get kicked out. You have permanent housing, and you have the wraparound support services that Paul described under one roof. So, I think from a policy perspective, it's great that the intent is there and the approvals are in by the states. The question that third sector cares about are, how are these policies, how are these good intentions going to be implemented? Because we want to tell the story 5, 10, 15 years that all these policy wins translated in these massive reductions in rearrest rates and in the increase in employment and well-being. That's the story we want to tell. We don't want to have good policy die with kind of crappy implementation. So that's the with governments, and I think the work that we did in Lane County with sponsors, parole and probation, and the housing authority is just a really, really good example of what this future looks like.
All right, man. I was caught up on how you're saying even with the healthcare, they moved over into the housing. I think that's strong. Another person tuning in, they said, in regard to providing services as a healthcare agency, we struggle with the housing component. You cannot incentivize treatment for MH and SUD by providing housing. This struggle places our reentry community with cost per housing from day one. Do you have any suggestions on how we can pivot? The 1115 waiver is only a pilot at this point.
Mm-hmm.
And so they was asking, do you have any suggestions on how they can pivot from the situation that they're in?
Yeah, happy to kick us off on that one. I think it's a really good observation, right? As far as incentive or in many ways like mandating treatment, we got to meet people where they're at, and I don't want to lose the thread that we started earlier around the value of lived experience. The way home provided permanent supportive housing for men and women released from prison that are homeless. The case management, which is a term that gets thrown around all the time. Like, what does that actually look like? You know, it was someone that was responsible for the care and the support for another human being. And that person carried, again, the lived experience that we've talked about here. They're trained and certified. And then more importantly, they're meeting them at the parks, at the cafe, at their, you know, in their homes, to build that buy-in, to build a trust for that individual to articulate what is their plan for reentry, and build around those strengths, build around those motivations and desires. I remember in this program early on, some folks had said, I want to reunite with my spouse. I want to reunite with my child. And the question was, okay, so how do we get you there? And then through that, then how you can talk about the SUD treatment, the mental health. So that's one piece I'll mention. The other piece I'll mention is the 1115 waivers, the health policies we're talking about. They also compensate organizations for providing peer support specialist services. That's a lot of words to say, to do the lived experience work and get paid for it. Right. and get paid for it. So, you know, so the system is recognizing it. I think our role at Third Sector is helping community-based organizations understand which departments should you talk to have the conversation, how to access those funds. If those funds are already being put out into the community, then we want to work with organizations to say, great, how can you partner with other community-based organizations? Or how can you partner with parole and probation or a housing authority to totally integrate it? But, you know, I think the big challenge with our government systems is that everything's split up county by county, county by county, county by county. Right. So it's going back to the relationships really makes that really critically important. Paul, I don't know if you want to add anything to it, but I felt that those two pieces on, you know, the meeting people where they're at and the lived experience tied under one roof really goes a long way.
Yeah, no, I think you nailed it.
Okay.
So what does the future look like in the reentry space for Third Sector Reentry Division in 5 years?
Yeah, great question, Cardell. I think the future is twofold. The first one is to continue to design and implement the programs that we know that work. Permanent supportive housing is a solution to addressing public safety. So we want to do more of that. You know, Lane County, again, is a semi-rural place, but whether it's in deep urban areas or rural areas, we want to figure out in leadership within parole and probation, within a housing authority, who wants to do something about this? And let's get to work, right? Let's roll up our sleeves. So doing more of what's worked is a big piece, Cardell. The second one is doing more work with the workforce systems and the early childhood systems. And what I mean by that is we spent the last 40 minutes talking about getting housed, being safe, right? Being stable so that you can access the services that you need. That's almost like part one. Once you're stable, then what? Right? How do you pay rent? How do you feed yourself and your family? So that's the employment piece. So tying reentry to education on the post-secondary front or workforce training is a big part of what we want to do more of. So for me, I'm like, what are the workforce boards interested in doing? On the early childhood front, I think, thinking about parents who are incarcerated, with children, that's tough. And we haven't talked about that cycle, right? At the end of the generational cycle and trauma that gets passed on. How do we break that? So we're curious to figure out, how can we ensure that there's quality and accessible childcare that's available for everyone, whether you're incarcerated or not? And then two, how do we better support those parents to build those bonds with their children on the inside and as they work their way out?
Right. Family reunification.
Yeah.
Because a lot of times that family is going to be the support system outside of support system that you get when you first get home, like that permanent support system. A lot of times it's be your family. So to build that reunification, that's definitely an important, and to break the generational cycle. I mean, my reentry program, that's what we always say. We're not here to reduce recidivism. We're here to break the generation cycle. right? And so we build what we call the whole person approach model. We focus on 5 dimensions of that person by meeting the person where they at. So we talk about the physical dimension, which is housing, all of them things, community organizations. On the inside, it's more so that it's wellness. It's making sure that the institutions provide an environment for somebody to learn, to grow. Because if you're in a prison where you got to worry about surviving and getting killed, you're not worrying about programming. You're worrying about making through the day, right? So we got to make sure. So that's part of the physical dimension. Then we do psychological dimension. We do social dimension. We do purpose dimension, and then we do what's the other purpose dimension, social dimension, and workforce dimension. Well, not it's economic dimension, but we focus on those 5 dimensions, and we try to meet the person where they at. And like I always, and what you're all saying is so important, and what you all do is so important because for me, you all are the pipeline that I always tell reentry programs to have on the outside, and to not have the pipeline all over the place, for it to be one place where somebody can go and they can get all the help and resources, so they don't have to be trying to run all the way around town, because a lot of us get out, we don't have vehicles, we don't know how to navigate bus systems, and things like that. We don't have money for Uber or none of that. And so to be able to have where someone can go, knowing that they're gonna have not only just secure housing to get started, but have these wraparound services that they don't have to run all over the place trying to get. So I really salute you all. I got 2 more questions. One of the questions is, what advice would you give someone who's trying to enter into the reentry support field? Because it's a lot of people coming out of prison, or it's a lot of other people coming into the reentry space. What advice do you give to them?
Yeah, that's a great question. I think the first thing I would say is listen more than you talk, right? Learn from people with lived experience. Don't assume that you know what's best, right? This work is about humility, it's about relationships, and it's about perseverance. And remember that progress isn't always linear. It's not this, straight shot where people go from homelessness and coming out of prison to being, a successful business person. But every step that we take in that process to move people forward matters. So those are some things that I would, for people that are thinking about getting involved in this field, that I think are really important.
And I think the angle I'll take to that, Cardell, is how do governments get more involved, right? They're the ones with the money. They're the ones with the power. They're the ones with the policies. How do they support more organizations like sponsors? The way I think about it, maybe the advice also applies to what just Paul said, listen to people that have gone through this and have the solution. I think from third sector's perspective, we would encourage departments of correction, parole and probation, housing authorities, workforce boards, healthcare plans. Talk to organizations like sponsors and ask, what are your results? What's working? And how can I help you do more of that? And if the answer to that question is there are some things that are working, they will also tell you, here's what I need help with. Like, let's pay attention to that and figure out how I can help you. That help can look like better information sharing, better referrals from one system to another, a parole officer figuring out there's a housing voucher that's available. How can I get that to you in hours or days instead of months? Same thing with funding. An organization may say, I do this program. It's very easy for a department to say, we don't fund that. We're not allowed to fund that. Showing up with curiosity really helps and wonder to say, you know what? I don't know how I can fund that, but you should talk to my counterpart at the health plan. They may have some ideas. Why don't we all get together and have a brainstorm conversation? So those are the things, that I would say, at least from the government perspective, that, if you focus on the outcome, what happens once programming is done? I think it will allow us to not worry so much about the bean counting of did you spend 3 hours on mentorship and 2 hours on therapy, but you actually focus on, did recidivism rates go down and did people stay housed? And if the answer to that question is yes, let's support that. And if we're falling short on that, let's find ways to bring it up. So that's really, I think, our call to probation departments, departments of correction, housing authorities in general, that the solutions are out there. It's a question to figure out how we can come together to implement this with your current resources.
Right. So as you know, this podcast is called the Reentry Journey. So the last question I asked everybody who's been on this podcast had been asked this question. But you are working in the field that you work in for the time that you have been working in. What is one word, if you had one word to describe your journey, what would that one word be and why?
I would say for me, it's been perseverance. And that's both in my own personal journey and also in the work that I've done with people and systems, because systems don't change by themselves, right?
Right.
People help change systems, and it requires perseverance, right? It requires the ability to continue to show up. I can't tell you how many meetings I've been in, whether with local officials or sitting in city council meetings and, being there and showing up and asking questions, having that curiosity, I think makes a big difference. And in order for programs like this to be successful, it requires perseverance. So that would be the one word that I would use.
All right.
I think my word would be responsive. I think about my old football coaches: read and react, head on a swivel. And I really feel that's what we're doing here. If people are being released from prison and they're homeless, okay, great. We're looking out. We're looking out for them. How can I help you? But the system needs to also look out for them. The same thing also applies with governments. If you're gonna fund permanent supportive housing to address public safety, figure out how you meet the needs of the organizations that are providing the case management and the housing. Respond to the challenges they're raising, and then together, work towards that end goal. That's kind of the way I think about it. And Cardell, for us, this is highly collaborative work. It all starts with people, just as Paul described it. And if there's no trust there, it's really, really, really hard to move forward. So if we invest the time in trust, then together as a system, as a government, as a nation, we can be responsive to the public safety and housing needs that we all have in our backyards.
And Cardell, can I share one more thought before we wrap up?
Yes, go ahead.
Yeah. So at the end of the day, the Way Home program that we've described to you, it is more than a program. It's a promise. It's a promise that we see the humanity in every person returning home from prison, that we believe in second chances, in dignity, and in the power of home to transform lives. If we want safer, healthier, more just communities, then we have to build systems that reflect those values.
Exactly.
And that starts with each of us choosing hope, choosing action, and choosing to walk alongside those finding their way home. Because I truly believe together we can build a future where everyone has the opportunity to move forward.
There it is right there. Nothing more needs to be said. Right there. It's the perfect exit for the podcast. I am your host, Cardell Sims. I'd like to thank Oscar and Paul for coming on, talking about the fabulous and amazing work that they're doing. Like to thank everybody who tuned in, that's commenting, and asking questions. I do want to say, is there a website or something people can learn more about it?
Yeah, can we post a link to the channel, or what's the best way to do this?
We can post. You can put the information in the comments website. You see the comments there.
Can you do that, Oscar? Because it's asking me to connect to YouTube to do it.
Sure can.
Great.
And we'll make sure to also drop in.
And then if it don't show up, we can put them in the comment section on YouTube, LinkedIn, and things like that.
Let's do that. Let's do that. We'll make sure to drop in our LinkedIn contact information, a link to this project at large, so people have all the details. And then Paul and I and both our organizations are definitely available to connect with people.
All right. Once again, thank you all for being a guest on the Reentry Journey. I look forward to all the work that you're going to continue to do in the future. I look forward to us possibly collaborating and working together and expanding expanding that necessary model that you all have into the area and in other areas. I really believe in the model. I know that model actually works. And it's a great foundational start for someone who's looking to put the past behind them, looking to move forward, at the same time surround themselves with all the resources that they need, not, the one size or the one shoe fits all, but what that person needs, right? And so, man, once again, thank you all. Really appreciate you all coming on. For the guys that's tuning in, that's going to be watching this, you need to talk to your reentry coordinators and people on the inside and say, this is the model we trying to adapt. And like I always say to you guys that's going to be watching on the inside, don't forget, don't let the limitations of your background reduce the height of your potential. Outgrow what you were born into. This is the Reentry Journey. I'm Cardell Sims. Until next time, be great.
From darkness to light, from confinement to freedom, this is the Reentry Journey podcast with your host, Cardell Sims, bringing you the powerful stories of those who have walked through prison gates and built meaningful lives beyond them. These aren't just stories of survival. They're testimonies of transformation, second chances, and the human capacity for change. Join us as we explore the challenges, triumphs, and lessons learned on the Reentry Journey.